Today's ICD-10 quick coding tip focuses on what you need to know about the time frame for coding and reporting of acute myocardial infarctions. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. An acute myocardial infarction, commonly referred to as a heart attack, happens when there's a sudden blockage of blood flow to the heart, which causes damage to the heart tissue. In ICD-10, you can find the codes for acute myocardial infarction in category I21. Codes from category I21, acute myocardial infarction, are used when the myocardial infarction is equal to or less than 28 days or 4 weeks from the initial occurrence. It's important to understand that these codes may still be assigned even if the patient is transferred to another hospital after the initial diagnosis, or if they require a new hospital admission within this 28-day time frame, as long as the patient is still receiving care for the acute myocardial infarction. However, for cases where the myocardial infarction is older than 28 days, the appropriate code to assign is I252, which represents old myocardial infarction. Let's take a look at some examples. For all of these scenarios, I will be using I219, acute myocardial infarction unspecified, because our main focus here is to understand the reporting time frame for an acute MI rather than how to code specific types of myocardial infarctions. In this first scenario, the patient is initially diagnosed with an acute myocardial infarction at Hospital A. Subsequently, the patient is transferred to Hospital B for a cardiac cath procedure. Hospital A assigns code I219 for acute myocardial infarction unspecified. What code should Hospital B assign in this case? In this particular scenario, Hospital B would also assign code I219 for acute myocardial infarction. This is because the guidelines state that the appropriate code from category I21 should be used for encounters that occur while the myocardial infarction is equal to or less than 4 weeks old. This includes transfers to another hospital where the patient requires ongoing care for the myocardial infarction. In this next scenario, we have a patient who had a myocardial infarction 3 weeks ago and is now back in the hospital for treatment of a COPD exacerbation. While in the hospital, the patient is continued on their cardiac medications. What code, if any, should be assigned for the myocardial infarction that occurred 3 weeks ago? According to the guidelines, we should use the I21 code for acute myocardial infarction as a secondary diagnosis. This is because the patient is still within 4 weeks of their heart attack and is still receiving care. The continuation of the patient's cardiac medication is considered to be therapeutic treatment, which means it qualifies as a reportable secondary diagnosis. In this scenario, it's noted in the record that the patient has recently experienced a myocardial infarction with plan to continue cardiac medications. What code, if any, should be assigned for the myocardial infarction? In this case, the documentation is vague and lacks sufficient information for an accurate diagnosis code assignment. So it would be necessary to initiate a query in order to seek clarification regarding the exact date of the recent heart attack, so that the correct code may be assigned. In this last scenario, a patient who is 5 weeks post-acute myocardial infarction has been readmitted for the treatment of a COPD exacerbation. What code, if any, should be assigned for the myocardial infarction? In this case, we will assign the code for I252, old myocardial infarction, as the occurrence of the myocardial infarction is more than 28 days ago. The guideline tells us that once a myocardial infarction is past 28 days from occurrence, it is considered to be old and codes from category I21 should no longer be used. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.